Hi everyone. For my final project, I'm analyzing the portrayal of obsessive compulsive disorder, or OCD, in the movie Turtles All the Way Down. According to the DSM-5 TR, OCD is characterized by the presence of obsessions, which are repetitive, intrusive thoughts, and compulsions, which are repetitive behaviors a person feels driven to perform to alleviate the anxiety caused by those thoughts. In the US, the lifetime prevalence of OCD is about 2.3%. It often presents with similarities to mental disorders like generalized anxiety disorder or depression. Standard treatment typically involves cognitive behavioral therapy, specifically exposure and response prevention, and sometimes SSRI medications. In the story of Turtles All the Way Down, Asa Holmes struggles with a specific obsession, and it is the fear of contracting C. diff, a severe bacterial infection. Let's look at this specific scene. Asa is at lunch with her friends, but she isn't present. She's not there socially. The narrative describes her thought spirals, and we see this type of thought spiral pop up throughout the entire story. And it's not all the same thing about bacteria, because she becomes obsessed with a small callus on her finger. To her, it is an open door to bacteria. This leads to her primary compulsion. She constantly reopens the wound on her finger to drain it, and then uses hand sanitizer internally. In 1 in 10 scene, she actually drinks hand sanitizer because of the intrusive thought. The demon, as she calls it, tells her she must sterilize her insides. This perfectly illustrates the obsessive anxiety compulsion relief cycle. The relief is only temporary, which is why she repeats the behavior dozens of times a day. Unlike many media portrayals, we see that Asa doesn't want to do this. She feels she has to in order to survive. So, how accurate is this? Let's look at the myth versus facts. Many movies portray OCD as like a quirk, like being very neat or liking things symmetrical. Asa, however, shows the reality. OCD is often invisible and focuses on intrusive, often terrifying thoughts rather than just cleanliness. The internal perspective. Producers use the first person narration to show the ethical implications of the disorder, how it affects Asa's ability to form romantic relationships or even be a good friend. Let's see what's accurate. The movie accurately depicts the waxing and waning nature of the disorder. Asa has moments of clarity followed by total thought spirals where logic fails. Let's look at the stereotypes. It often avoids like the genius stereotype often seen in media like Monk. However, Asa is a bright student, but her OCD is a hindrance to her intelligence, not the source of it. Portrayals like Asa's are vital for reducing stigma. By showing the internal pain of OCD, it encourages others to seek help rather than just feel crazy. If you are supporting someone with OCD, the best thing you can do is educate yourself, avoid validating their compulsions, which can make them worse, and encourage professional treatment. If you or someone you know is struggling, please reach out to the 988 Suicide or and Crisis Lifeline or organizations like NAMI. Remember, you are not your thoughts.